Welcome to HIT Podcast, H.I.T, Human Resources, Insurance, and Technology. I'm your host, Toby Kennedy. As with every week, we're dropping into your feed on Tuesdays with what we hope are bite-sized, digestible, well-curated conversations with some of the goings-on in the space. This week will be no exception. This week's episode is brought to you by Montage Insurance Solutions. And without any further ado, let's get right into it. I am very pleased to bring on my guest, Carolyn Grant. Carolyn, how are you? Thank you so much for joining us.
Great. Nice to see you all. I'm here in hot and sunny Florida.
Yep.
A little bit time difference, but great. Nice to be on.
Yeah, no, that's good. Well, so, we're out here in Calabasas and it's warm too. I don't want to have a warm off because I'm sure we'll lose to Florida, but it's hot out there. I understand. So what I wanted to do was maybe dive in a little bit about some of the unique angles and spaces you guys take in the healthcare ecosystem, but maybe just a really quick kind of give me the nickel tour of your resume, how we find you in the chair today. Talk to me a little bit about kind of your background.
Sure. So my name is Carolyn Grant. I'm in the Orlando, Florida, Central Florida area. I've been here 30 years. I started off here working for Disney, worked for the mouse, and then kind of fell into insurance. And I've been doing insurance and employee benefits for a long time.
Yeah.
So I have a unique situation. For the past 10 years, I work for a company called Rosen Hotels and Resorts. So Mr. Rosen owns several hotels here in the Orlando area, but he owns an insurance division called RosenSure. So RosenSure is we take the concepts of Rosen Hotels and Resorts health plan, and we evangelize them out to outside companies to help the other business owners with their costs for their health plan and maintaining that plan to have better outcomes and provide a better plan for their employees also. So that's what I do.
Yeah, and that's interesting, and that gets us right into it. So the genesis of this is Rosen Hotels did something unique. They found some success with it, and now we're talking about replicating a little bit of that. Why don't we back up and talk about what makes this health plan unique?
So the health plan is very unique in that I think it's I almost say it's like going back in time.
Yeah.
When you had a personal relationship with your family physician. If you could remember back when your doctor, you'd call them, they knew all the members of your family, you'd see them at Little League games and things like that. That's literally the center point of our health plan is value-based primary care. We believe in having the primary care at the hub of a health plan and then, exposing everything out from there, expanding everything from there really, really helps the employees navigate the very complicated health system and really provides a better experience for them because someone's guiding them through this process. So what's something that's very unique to us is that we have an on-site medical center here. So we built a whole building where our employees and their dependents go for all of their primary care. Now, for those that live outside the area and things like that, we have, set up different arrangements, but for the most part, everybody comes to our medical center. But we realize that for other clients, not everybody has 1,000, employees in a single area, so they can't do that also. So we have built some shared clinics in our area, so several employees can share a clinic, but also we have relationships with direct primary care doctors. Have you ever discussed that relationship or that program?
No, this is really interesting to get into. So yeah, you keep going. This is really fascinating angle on healthcare.
Yeah, so there are doctors out there that choose not to work with insurance companies anymore, and they have a membership-based program where the employer will pay a monthly fee for unlimited services for that doctor. And so we built up our own little network of direct primary care doctors, and it's going really, really well. So, but everything stemming from primary care. What we find is that when we bring on new groups, is that many people are going to so many different doctors for this, for that, and the doctor never took the time to understand all the symptoms that were going on with them or all the medications they were taking. But once they have that hour-long appointment, yes, an hour-long appointment with their doctor, somebody who can understand and engage with them, they so much appreciated it. And so it just really turned the entire health plan upside down as far as claims to specialists, claims to the emergency room, all of that trend goes extremely down.
Yeah. So starting it off, what we're saying is the backbone or pillar number one, and we'll get into some of the other kind of parts of this ecosystem, but is taking some of your spend and shifting those dollars to building out a direct primary care relationship, either through, like you said, building your own on site when we had 1,000 people, or these sort of co-shared primary care relationships.
Correct. So depending on the demographics of the population, that might be spread throughout, the area or whatever, but there are solutions that employers can engage with so that the members have a better experience. So we always want to have a positive experience, but also better outcomes for the members and their dependents. So that's what we always look for. So we've had wonderful, wonderful results with it.
Yeah, and so you've mentioned results a couple times, and even the trend going down. We can again build out the rest of this dialogue, but focusing here, do you have a couple of kind of facts, figures, or when you mentioned some of the matrices you're looking at?
Sure. So I mean, I can go over Rosen, and Rosen's is well documented. Of if you look up Rosen Hotels and Resorts or Harris Rosen, you can see all of the awards that we've won for our health plan, and the millions of dollars that we have saved over the years. But Mr. Rosen has developed his philanthropy is the money that he has saved through the health plan. We support the community, and that he has sponsored 2 neighborhoods in our area, and he has turned these savings into investment into that area where he provides preschool to all the children in those neighborhoods. He provides guardianship and guidance counseling to the kids that go through that through high school. If they graduate from the program, if they graduate high school, Mr. Rosen pays for their college, whether it be college, vocational school, whatever. He will pay for that, for tuition, room and board, transportation, whatever it is. Mr. Rosen pays for that. And he does that all from the savings from our health plan.
I love that story. I'm so glad. I know it's so special.
He's my hero, and I love the man.
Yeah.
And he's so passionate about, he's a hotelier, he's an entrepreneur. What his legacy will be is on healthcare and on education. Investing in those 2 will change a person's life.
I could not concur more wholeheartedly. So circling back and just kind of keeping, because the moving pieces of this are kind of what makes it go and what's so interesting. So we talked a little bit about the direct primary care feature to this kind of healthcare setup. What's another pillar? Talk to me about some of the other things going on.
The other thing is becoming a self-insured or self-funded health plan. It's really hard to do any of these levers and do anything creative when you're in a fully insured platform with an insurance company. There aren't incentives for the insurance companies to save you money. They make more money when you have a higher premium. So there's no incentive for them. So the only way to control your costs as an employer for your health plan is to enter a self-funded arrangement. And they can go pretty low now. People say, well, we're only 300 people and we're too small. I'm like, 300 people? Why aren't you self-funded?
Yeah. I mean, depending upon how you build out the level funded or stop loss arrangement, we've got groups that have, 20, 50, 80 lives that self-fund very successfully. So I agree with that piece. So you're talking about, first of all, changing the funding mechanics. So I probably should have started there. So thank you for starting us there. Once you're in this sort of self-funded arrangement, now, you're not in the health insurance game, you're in the health care game. So you need to put some downward pressure on some of the claims. Can you talk to me about successful strategies that you have seen in either it's pharmaceutical or surgery center, or some of the spaces that you guys have said, hey, we also, in addition to the direct primary care relationship, focus in on this thing, and this thing, and that's been a part of our secret sauce as well?
Sure. We always believe that plan design and access to care is very, very valuable. We don't believe in HSAs. We don't believe in high deductible plans. We believe the actual opposite. when you provide a value to an employee that they can access care very easily. So under our plan, you go to the medical center on the clock. Mr. Rose even pays you to go. But again, not everybody has to do that. But providing somewhere that they can call or get in same day, next day, get their generic medications at least at a very low or even no copay. So that's very, very important. So when you're designing the plan, that they know where to go and it has a low barrier to care. That's super, super important. These big deductibles and, deductibles for pharmacy and big copays for brand name or non-brand name and who controls the formulary. I know I could talk about this all day long, but it'd be boring to your other people. Why not you control that than the pharmacy company that's making billions of dollars a year? So we say, have it run by Main Street, not Wall Street. So put you in the driver's seat and you control your plan, and your advisor will help you with that. You don't have to do everything at once. I encourage the groups that I'm transitioning to do kind of a stepping stone, and we'll kind of roll it out for the next couple of years so the employees don't feel overwhelmed. But so other than self-funded, the next thing is proper navigation of the plan. People somehow think that they're doctors and that they know where to go. People don't know where to go. I mean, I'm in the industry and I don't know where to go. I don't know what doctor is good and what doctor's a hack, or what doctor, what percent of cesareans versus traditional delivery, or things like that. We don't have access to that information. So having a resource that the employees or the members can call and speak to somebody who can talk their language, but also talk the medical language behind the scenes, and saying, okay, so what type of doctor you're looking for, what exactly are your needs? Because sometimes the words that come out of members' mouth isn't exactly what they need. Mm-hmm. Or, maybe their symptoms is something, a lady might have symptoms of something that could be a symptom of a heart attack or something like that. So a nurse or somebody in those fields can help them navigate where to go. And the doctor who did a knee replacement on a 28-year-old triathlete might be very different than the doctor who's doing a knee replacement on a 63-year-old with comorbidities, right? So there is not one doctor for everyone. It's who's the best doctor for you at that time for that condition. And so we do all of that research, who has the best outcomes, who has, we look at are they licensed and things like that, who has the least amount of complication rates, because we find that the best doctors overall charge the least amount of money.
I think that that's probably the most shocking revelation as you really dive into the healthcare world, to find out that unlike almost any other space, the relationship between cost and quality is at best tenuous and probably more accurately not there at all.
Correct. It's crazy. But when we do meetings for employees and stuff like that, we show them and show them, would you rather go to this doctor or this doctor? But how do you know? And I'll have screenshots of, my Facebook that says, looking for a new doctor. That's how people are trying to look for doctors.
It's outrageous. Yeah.
But if you had
the navigation aspect.
Yeah, the navigation aspect is really key for employees to feel that they can call this person with their questions. Hey, am I having a, interaction with a couple of my prescription drugs, or, I feel like I'm having headaches a lot. What should I do? And having that person to talk with them and guiding them through the process is so key versus going on WebMD,
Yeah. Well, yeah. Dr. Google. Yeah. So as we're kind of backing this up and we're working our way through it, Rosen Hotels and the healthcare model that you guys have had such tremendous success with, a backbone of that is the direct primary care relationship we spoke about. The mechanism behind the claims funding is a self-insured setup. And then we start talking about navigation of care, meaning as my members go to seek an episode of care, we look at which physician, facility, provider of care we set them into, that has so many downstream effects on the ultimate cost that it is imperative to try to steer when possible. And as we talk about maybe other moving pieces to designing this kind of very, successful model, talk to me about maybe a few other places that you guys have identified and taken a strategy to when you built out this mousetrap.
Well, we're blessed here in that almost all of our members are in one space. So we have a very unique opportunity with that. There are other companies too. But so what we have done is we have gone out into the medical uh, community, and we have direct relationships and direct contracts with great providers here. So if it whether it be an orthopedic, a cardiologist, an OBGYN, we have our medical director and our medical doctors have relationship with those doctors. So when we give somebody a referral or they're going to go see that OBGYN because they're now high risk pregnancy, we have that relationship. Our employees float to the top.
Mm.
We pay them directly, and we pay them fast. So we pay them a lot more than the insurance companies pay them, but it's a lot less than what we were paying them through the insurance company.
Right.
So often there's a big disparity in between there. So it's a wonderful, so it's really a three-way relationship between the member, the provider, and their other provider. So it's, and the plan all work together, all on the same side. You can't say to a doctor, I want to send my people to you, but give me a lower rate. I want to pay lower. No, that's not what we do. We pay them fair and we pay them fast.
Yeah. So we've talked a little bit about how you've designed what you and I are kind of describing as an effective mousetrap. And you mentioned that there's dollars left over to go towards some really, really beautiful philanthropic work. But maybe now that we've talked about kind of how this healthcare model has been a success, do you mind telling me, hey, we beat the averages by X%, or we've, averaged, N renewal, or kind of what's coming out the back end that makes us say that this mousetrap worked?
Yeah. So when you go through plans, and there's grades on plans when you put all of the copays and things like that. So we have a platinum level plan. Like there's really no higher plan metal that you can go to for our plan. And the actuaries have estimated that if another company had our plan at a fully insured or an insurance company rate, we're about half the cost.
Unbelievable.
50% of the regular cost is what we pay for our plan. And it's not like, we're rocket scientists. You don't need to be a rocket scientist. It's really just common sense and smart business. If I want something done, I go direct to that person and do a handshake or do an agreement. I want to pay you. I'll pay you more money and I'll pay you fast. Okay. And then, but also always keeping the member and the patient right here in the forefront of your brain. Because we always think if we make everything about that and doing the right thing, the money will follow. So that's always something that we're always conscious of. But then we also think about, we're always out there looking for innovative stuff. So what's new and what's innovative, but also what's innovative that might be dangerous to us. So, innovative, I'm sure medical marijuana is a big deal out in California. It is allowed here in Florida, but not recreational. But we have medical marijuana on our health plan.
Right.
So it is proven to work for some people. And if that works for you, have at it. We have supplements through our health plan. So things like, magnesium, turmeric, there are holistic medicines or holistic things that can also help your medical outcomes. And we support that. So we'd rather have you take a turmeric rather than taking ibuprofen every day.
Sure.
So if it works for you, we want to support that. So those are really some innovative things we do. Other things we do on site. A lot of our population, you need to understand, we have a third population English, third population is Spanish speaking, and a third of our population is French Creole from Haiti.
Oh, yeah, nice.
So they don't often, don't have anywhere else to go that people will speak with them. But we bring things on site. So we have mobile mammograms twice a month. So we bring a mobile mammogram facility on site at the health center for people that maybe can't go to another place and have their mammograms done. We bring on-site, this is our new thing, it's really cool, on-site mobile dermatology.
Mm-hmm.
So I don't know if you've called dermatologists lately, 6 months to get a screening in there. So it's tough to get them. And here in Florida, we're all subjected to skin cancer.
Sure.
Even if your skin is darker than mine, you're still subjected to skin cancer. So we've been doing it for about 6 or 8 months now. We brought it to a couple other clients. One client in the first 3 or 4 months, 3 melanomas we found.
Wow. Wow.
That's changing someone's life. That's saving someone's life.
Yeah.
So that's what's so rewarding and so gratifying about doing things like this, is that you're implementing and you're doing things that are so making impactful for people, and you're changing their life, and it's so gratifying. As an advisor, I could work for a big house. I could go work for the big companies, the Gallaghers, the Aons, the Marshes, and probably live in a much bigger house and drive a much fancier car than I have. But I know that what I'm doing is a lot more work, but it's so more rewarding. I love going to my groups now, and when I go in, we hug, we cry, we do all these different things, because they said, what would I have done without the nurse or whatever program we have? So I love it. I love it.
I love that. And so I think that the Rosen Hotel healthcare example is a well-documented example of how to do things unique, and having someone on the ground from that to be able to come in, share a few of the insights is just so valuable. I can't tell you how much I appreciate your time and you coming on and you sharing some of your wisdom with our audience to bring us home. Any final thoughts?
My final thought for people, especially those in HR or in a C-suite position with a company, is don't be afraid. It can be done. It's not rocket science. The biggest thing you need is a lot of courage. A courage to stand up and saying, no, I'm done. I'm not going to play that game anymore, because it is a game and it's a total mousetrap that you will never win. You will never win. So if you want to make a difference in your bottom line and in your employees' lives, then you have to have the courage to do something different. You're not going to get the same result. You're not going to get results from doing the same thing.
Yeah, I appreciate that. And that's exactly what we try to do as a firm. That's obviously why we try to keep our ear to the ground, bring on experts like you. Thank you so much for your time. And that is all the time we have for you on this week's episode. Thank you to our sponsors, Excel Health and True Hue. Thank you so much for joining us, Carolyn. That's all the time we have this week. Join us next week. Join us every week. And until next week, make this the best week yet.